Good afternoon, CSU. I hope everyone's week is off to a great start. Thanks for joining us today for the COVID-19 update. It's my honor to introduce today's speaker, Dr. John Rott. Dr. Rott is the Assistant Regional Medical Director at Kaiser Permanente. He's also a board-certified practicing pediatrician at Kaiser San Diego. Dr. Rott received his training at Princeton, University of Texas, Stanford, Baylor School of Medicine, and across the pond at Oxford University. He has a master's degree in public health, and his focus was on chronic disease management. Dr. Rott has held numerous administrative positions at Kaiser, and he also enjoys teaching meditation, camping, and he plays the violin. He's an expert in his field and eminently qualified to speak with us today. Dr. Rott, thank you so much for joining us. Welcome from CSU.
Thank you, Tammy. It's so good to be back with CSU again. And to those of you who've seen some of the previous webinars, good to have you back. Since we do have a lot of return customers, I thought I would start with the stuff that's new. So I'm going to start with an update kind of on the virus, Delta, everything you ever wanted to know, hopefully. I do want to go a little deeper into these things than maybe what you get on the news, so that you'll appreciate the nuance. A lot of the messages we're getting these days are sound bites, and these are complex topics, and I want you to understand it a little more deeply. So buckle up, and then at the end, I'm going to go into, we've got a big list of questions that got emailed in, a lot of stuff about the vaccine, safety, efficacy, crazy conspiracy theories, and the like. So we'll get into more of that later in the talk. But first, I just wanted to give you a couple of things about why listen to me. I know Tammy says I'm a trusted expert, but let me give you a few more things. So in addition to the education she outlined, I've got 20 years of practice experience as a pediatrician. So vaccines to thousands in my practice and seen firsthand the benefits and the issues that sometimes happen. Next, parenthood. I am a father, and so I have a strong personal vested interest in getting this right. Finally, I want to make sure that you understand I have zero conflicts of interest here. CSU is not saying drug companies are not giving me anything. I don't make any outside of my regular income from Kaiser Permanente. So why do we need this COVID vaccine? This is all pretty basic stuff. There are young, healthy people ending up in the ICUs needlessly, and it's such a tragedy. This new variant is highly, highly transmissible, much more than the original. It's indistinguishable from a cold at first, so it's difficult to diagnose without doing the swab. And if you haven't been vaccinated, the immunity is, you probably don't have it. Treatment options are minimal. Yeah, we've got a few things here and there, but we don't really have a good treatment if you get it and you get into serious trouble. So there's a lot of good reason to get that vaccine. I don't want to see any more people end up like this. Now, all right, nuance. So you guys probably have seen this data or something like it. This is from the County of San Diego. There's similar data that the California Department of Public Health is posting. And what they're doing is they're saying, since January, from January 1st to today, what percentage of people that got COVID and ended up in the hospital or died of COVID were not vaccinated? And the numbers are really strong. You see there, 99.8% of people who were hospitalized or died were unvaccinated. While these numbers are accurate, they're a little bit misleading, and I want you to understand why. So first quarter, January, the vaccine wasn't available for most of you. So there were low vaccination rates anyway. The first 6 months of the year were almost entirely the Epsilon and then the Alpha or the British variant, B.1.1.7. Not the Delta. We've only seen the Delta in the past month. So what we really want to know is what's our risk today in the situation that we're at with the Delta variant that we're fighting. And those numbers are a little different. They're not quite as, they're strong, but they're not quite as strong as you see here. And that's important because I don't want you to have a false sense of security that just because you got the vaccine, you can't possibly get COVID. And that's clearly not true. We are seeing people with breakthrough infections. Now, the rate of those is far lower. So if you're vaccinated, you're much less likely to get it, but it's a breakthrough infection is still possible. And people that get the breakthrough infections, they're milder, so they're not as likely to be hospitalized or die. But, you know, I still wear my mask when I go indoors because if I had a breakthrough infection, even a mild one, take it home and spread it to somebody, spread it to my family, spread it to patients that I'm taking care of, not want to get COVID, even a mild case. And so I think you should too right now. All right, more later. Next thing for y'all, I think Memorial Day came around. We all cheered and said, woohoo, COVID's over. And that was just too soon, my friends, too soon. COVID wasn't over. And it's coming back again with Delta. And after Delta, it's almost certainly going to be something else. We're going to be dealing with COVID for a long, long time. And so I think it's very important that we look to the big picture, protect ourselves when needed, and really look to vaccination. So I'm glad you're here with me today to learn more about that. Now, this is hot off the presses. This is from the LA Times, I think yesterday. So I'm going to give you now an update on cases. The first thing I want to point out on this graph, the low, moderate, substantial, and high that you see on the left side here, my left anyway, those represent the colored tiers that we used to have. The tiers went away in June. These are the levels of those tiers. So the low was yellow, the moderate was orange, was red, and the purple was high. Well, as of past July 17th, LA County is now back in the purple tier if they go by the old criteria. I think most people do not appreciate how fast this is regrown and how much this Delta variant is circulating right now. You can also see on this graph Sacramento County, then SF Bay Area, and Fresno County down there at the bottom where it hasn't quite gotten going as strong in Fresno as in other places. This is data from the County of LA on test positivity. And what you see there is an exponential curve, right? Zooming up, not really any significant sign of slowing down. And this is hospitalized patients in LA County. And you see that also zooming up. So we're now higher than we were back in mid-April for hospitalized COVID patients. And from when you get to when you get sick, to when you get tested, to when you get the results back, to when the results get to the county and the state, and then get pumped out is maybe weeks about. So the numbers that we're reporting today for cases are 2 weeks behind. Hospitalizations, maybe a couple of weeks behind that. So this is all lagging information. And I expect the reality today is even worse. I've seen no evidence of anything turning around. Why has this happened? Two big reasons. One, we threw away our masks because a lot of experts told us to. I get that. We returned to life as normal. The governor opened the state back up. You know, all this stuff happened. We went out and we went back amongst our lives. And at the same time, this new highly transmissible variant that started in India, the Delta variant, came and started growing in our population. Now, a key concept here for you guys is that the variants compete with each other. It's not like they all kind of go simultaneously, but they fight it out. And whichever is the most transmissible variant typically will win and push out the others. So when you look at these numbers, a slide for those of you that love numbers, Epsilon is the so-called California variant that was responsible for the big spike we had in January and February. January, February, in the green box there in the middle, 49%, 59%. So the vast majority of the cases in mid-February were Epsilon. Then Epsilon pretty rapidly died out and Alpha took off. So if you look over at the column left, you can see the Alpha variant, which became the dominant strain April and May. That's the British variant, the B117 is the Alpha variant. And then in the red, you can see this is data from June of Delta rising. The best estimates we have right now, I was just talking to our infectious disease expert this morning, said we're probably 90% Delta right now. It's so much more transmissible than the previous variants, and it's definitely outcompeting the others. So let me show you that in a different way to help you understand. This is a graph from the CDC. And you can see that darker orange is the Delta variant pushing up. And this was as of July 3rd, so fairly far behind. And you can see the British variant, the B117, and the other variants kind of dying off. And if we were able to look today, our best guess is that we'd be about 90% on that dark orange bar of Delta. So how is Delta different? A lot of people want to know. So the first thing, the best estimate we have is it's 225% more transmissible than the original COVID. COVID is spread by sharing the breath. I breathe out. If somebody breathes in my breath, they can catch the disease. Now, with the original strain, we estimated you had to share about 10 breaths to catch COVID. And that led people to say things like, if you pass somebody on the street, you don't have to wear a mask because you're not going to share 10 breaths with them. You're not going to catch COVID. Was a little dodgy advice at the beginning, but it made some sense. Now, with this strain being so much more transmissible, you'll get it with far fewer breaths. It may just be a couple of breaths that you breathe in and you could catch it. Now, the Delta has some different characteristics. It has a much higher viral load right at the beginning of the infection, at least 10 times the viral load of the original. So when you breathe out, your body has that much more COVID and that much more comes out, which helps it to transmit through the air. It causes symptoms that are a little different. So the original COVID was much more of a sore throat and a cough. The new Delta variant is causing more of a cold, more of a runny nose. The incubation period has changed. Originally, we were looking at 6 to 7 days from when you caught the virus until you developed symptoms. And now we're looking at 4 or 5 days. So it's a quicker incubation with a higher viral load initially, and causes symptoms that look much more like a common cold than say a sore throat and bronchitis like we had originally seen. Now, fortunately, the Delta does not appear to be any more lethal than the original infection. All the data I've seen suggest it's about the same. Hospitalizations and deaths, it's not dramatically different. It's not dramatically better. It's not dramatically worse. Last thing I'm going to say here about Delta, spread the same way as coronaviruses, and that is through the air, through sharing the breath. So the benefit is with a mask. Now, your mask needs to fit like a gas mask, to seal around your nose, under your chin. You want all of your air to go to that mask, so that you're only breathing in filtered air and all your breathing out is filtered. Wearing your mask with your nose sticking out or loosely, it's just kind of barely there on your face. If you're going to bother to wear a mask, it well so that you're protected and that you protect others. All right, one more thing, immunity and vaccines and Delta. A big question for people. And as of last week, we have pretty good data that all of the current vaccines in this country are good at protecting you against the Delta variant. So the Pfizer, the Moderna, the J&J, it's probably in the range of 80 to 90% protection against Delta in the real world. But 98, 99% against severe disease and hospitalization, which is what matters the most. We want to keep you from that. So what if I only got one shot and didn't go back and get the other? You know, about 10% of people have gotten one shot and have not bothered to go back and get the second one. They're probably 50% protected or less. So not such good protection from one shot. You really seem to need the second one to get good protection. And then the other thing that's come up a lot is people say, well, I have natural immunity. I had COVID, or I've even heard people calling it, I had natural vaccination because I fought off the disease. Unfortunately, is leaving people vulnerable right now. The Delta variant is different enough from the original COVID that you're maybe 50-50 on your protection if you had the disease. You are far more protected if you get the vaccine. The recent studies, you boost your antibody levels 1,000 times if you get that vaccine. So please don't assume that because you had COVID, you're going to be safe, because I just don't think that's going to be true for you, as experience is demonstrating all over the world right now. Okay, well, I hope you're still hanging with me. I'm going to go a little bit into this question. I've been hearing a lot about boosters. Well, we got a new variant. Do I need to get a booster shot? And before we get into all of that, I'm going to share a little bit with you about immunity. Don't worry, this will be easy. I'm not going to get too hardcore on you, just a little bit. You've been hearing this term in the news, neutralizing antibodies. Well, what are those? Antibodies are molecule proteins produced through B cells in our bodies, and the neutral antibodies directly knock out whatever they're targeting. So these particular antibodies are swarming around a coronavirus, and they render it completely, do that by inactivating a key protein that it needs to attach somewhere, but neutralizing knocks it down. Okay. Next. That's different than something called binding antibodies. A binding antibody acts as a spotlight. So it just shows the body's immune system, your cells, like your macrophages, conveniently looking like Pac-Man today, come in and eat that coronavirus. So the antibody doesn't do it itself, but it marks the cell. Now, there are other ways that our immune system gets rid of problem organisms, viruses, and bacteria. We have T cells, and we have T helper cells and T natural killer cells. Sounds like it could be a Hollywood movie. And these cells go in and directly attack in the case of the natural killer, or help coordinate an attack in the case of helper cells. And they have long memories of infections that the body has previously fought. So you can maintain immune memory in other ways than just antibodies. And the B cells that produce those antibodies, well, after a while, they typically slow down or stop producing the antibody, but they maintain the memory of it, and we call those memory B cells. And memory B cells can be reactivated very quickly and produce a whole new batch of antibodies. We know from studies that antibody levels to COVID go down pretty quickly. Antibody go down pretty quickly. But in the real world, some of other memory, and we're not sure exactly how it all works yet, combination of the memory B cells and the T cells still remembering COVID. And even though the antibody levels have fallen to a certain extent, person is still able to fight it off, that's had that vaccine and had that immunity generated. The point for all of this, one, is it's really confusing when you hear studies and people talk about, well, there was a tenfold drop in neutralizing antibodies. And you like, well, is neutralizing antibodies really the right thing to look at or not? You have to have some skepticism. And what I'd advise you to look for are real world vaccine effectiveness. How many people actually got the disease after they got the vaccine? That's different than what antibody level did people have after they had the disease or after had the vaccine. That's all kind of proxy measures and doesn't really tell you what you want to know. When we look at these real world studies, that's when things are getting really solid for us. So you can see on this slide effectiveness of the vaccines against some of the earlier variants. But I know what you want to know is Delta. And we've got two good data sources right now on Delta. In England had Delta way before we did. And vaccine effectiveness there has been around 88%, which is pretty darn good. Their effectiveness against Delta at only 64%. I think some of this is in the data and how they collected it and what they count as a case versus what they don't. The infectious disease experts I'm working with are saying, the real effectiveness of our vaccines against Delta is probably in the 80s, maybe not quite as good as 88% that they got in England, but close is what people think. So, am I going to need a booster shot? All right, we don't really know yet, but I can tell you how it's likely to play out. I think special populations are going to get booster shots in the not too distant future. It could be as early as a couple of months from now. So what do I mean? People that are especially at risk for COVID, the elderly, long-term care, healthcare workers, immunocompromised folks, people we really want to be sure are extra protected, they'll go first. There's a limited supply of vaccine in the world, and I imagine the booster work will go to these people. We'll see how things go, and the best way to booster up. We don't know the answer to that question yet. It very well may be that one of the new shots specifically against Delta will be the booster that gets recommended later this year or early into next year. It may be like Pfizer's trying to push right now to have people get a third Pfizer vaccine. None of the professional societies have agreed. The CDC doesn't agree. The FDA doesn't agree. None of them are recommending that, but I know Pfizer is pushing it. And then there have been studies in England looking at mixing and matching. And it may be that if you got the Moderna, you're better off getting a Pfizer as a booster to broaden your immunity. Those are unanswered questions. I do not have a good enough data to give you anything. What I can say is these folks on this slide probably going to get a booster in 2 months. That's my bet. We'll figure something out. They'll get it. And then other people into the year, start of next year or sometime, is what I would expect, but nothing in the short term. In the short term, immunity from the vaccine seems to be lasting, be good for a year. People from the original studies still seem to have reasonably good immunity, better than we thought, thank goodness. So hold on that. Now, so I think all the stuff leads us with a pretty stark choice here, my friends. COVID is not going away. The new COVID, the Delta, is highly, highly transmissible. This idea that if you just waited long enough, you could kind of squeak by and not get the vaccine, it's not going to happen. Now, you're going to pick. If you don't get the vaccine, at some point, I think you're almost certainly going to catch COVID. And if you catch COVID, yeah, you'll mostly likely fight it off, but there are people who don't, even young, healthy people who don't. And about 1 in 10 people who fight off COVID are having some kind of long, they call them the long haulers symptoms. About 1 in 20 teenagers are having chronic symptoms after COVID. It's not a benign disease, and unfortunately, people are tending to overestimate the dangers of the vaccine and underestimate the dangers of COVID. If you look at those two, it's not even close. All right, let me go just a few words about long haulers. So we're defining that as people having symptoms 3 weeks or longer. Many of these people had a very mild case of COVID and new symptoms came up in that time, though. And the most common ones being chronic fatigue, cough, a lot of rashes, diarrhea, weight loss, hair loss, nail changes, crazy stuff. Most common age is about 45, women more than men. Less common in younger and less common in older folks, interestingly. Okay, that's what I'm going to say on long haulers for today. We can do more in the chat if we need to. Myocarditis. So this has been in the news a lot. This is the CDC came out with these. These are all statements on this slide are all direct quotes from the CDC, and I concur wholeheartedly with all of these. So there are some, particularly teenagers and young adults, who are getting inflammation in the heart muscle, myocarditis. A week or two after getting their second dose of the vaccine. It's more common in boys, but it could happen in either gender. The things to know about this, first of all the ones we've had in Southern California here where I am have gotten better within a week and been fine. So mostly this is a relatively benign condition. Now, as serious it can be, and if someone had an underlying heart disease, everybody we've seen so far, it's pretty much been a minor non-event kind of thing. We follow them, we give them some treatment, and they get better. It's very, very rare, as the CDC says here in the slide, extremely rare, much less rare than COVID. And the middle point there, yes, it's mild. And the last one is COVID causes myocarditis and pericarditis, which is inflammation in the sac around the heart. And the myocarditis and pericarditis is both far more common than the myocarditis from the vaccine. It's far more deadly too. It's more common and it's much more severe. So people out there holding off on the vaccine in their young adults because of this, I think they're really missing the boat, that the COVID is far more dangerous than this very, very, very rare side effect. To my mind, it's a no-brainer. And my friend, the pediatric cardiologist, who's getting inundated with questions about this, says, look, this is not a big deal. Get your kids vaccinated. And that's what I would urge you to. myths. I used this last time, but for those of you who weren't with me, there's so much misinformation out how the vaccines work. So none of the current vaccines, either the RNA vaccines or the DNA vaccines, incorporate into your DNA. They use that genetic material to have your cells, they disintegrate and get eliminated by your body, stay in your body long term. They're there. Your body makes a few spike proteins. Your immune system responds to those spike proteins, and then all of that goes away. Now, altering DNA is important because if you alter DNA, you have the potential of causing cancer. Cancer is caused by mutations in the DNA. None of these shots incorporate or cause any changes in DNA. They cannot cause cancer from that mechanism, which is important. Nonsense about microchips. Some of the vaccines are grown in cell lines that were taken from fetal tissue, human fetal tissue, back in the 60s and 70s, and have since been grown in the lab for hundreds of thousands of generations. So very far removed from where they came from. And all of that is filtered out before the vaccine is delivered. So I think it's really a stretch to say that any aborted human fetal tissue is there. We've got great evidence the vaccines work. There's no complete COVID in the vaccine, in any of the vaccines, so you can't possibly catch COVID from a vaccine. That's nuts. Israel has more vaccinations than anyone, and yes, they're kosher, they're fine. That's nonsense. And then one of the persistent ones has been around, and many women who get vaccinated will have a disruptor cycle. They may have a heavy cycle or a light cycle or miss a cycle. It's that one cycle and then they're back. This is not a long-term change. We think it's due to just the stress of getting vaccinated and the stress of your body reacting to the vaccine. Anything that's stressful can cause a woman to have a disruption in their menstrual cycle. That does not mean anything about infertility. In fact, there's great data now around people getting pregnant after getting the vaccine. There doesn't seem to be any impact. Tens of thousands of pregnant women have gotten the vaccine. There doesn't seem to be any negative impact on the fetuses. In fact, pregnant women do pass on protective antibodies to their infants, and that's a good reason for them to get it. The other thing that's really critical to know is that women who are pregnant have a much higher risk of serious bad outcomes from COVID. So now the professional societies are all saying pregnant women should get vaccinated. We think it's the best thing for them to do to protect their babies. Getting the vaccine these days is super easy. You should have anywhere, someplace near you. It should be easy. You can always go to the website. KP gives vaccines to KP members and non-members. You do not have to be a KP member to get a vaccine with us, or you can go to this myturn.ca.gov. That's probably the best place to go. Go there and get directed to a center. There's lots of availability. You won't have any problem. You'll get right in. All right. Well, thank you for hanging with me on all of that. And that brings me to questions. Sunny, are you there?
Yes, Dr. Rod, I am here. So thank you so much for that comprehensive overview and sharing that great information with us. So I am Sunny Smith. I'm a territory manager for Kaiser Permanente, and I'm going to be assisting Dr. Rod in facilitating the question and answer portion of today's session. So I will start with our first question. So this is something you covered, Dr. Rod, regarding adults, but a question did come in regarding adolescent girls. So there's a lot of misinformation and lack of clarity regarding young girls getting vaccinated. What information is available on the 12 and older girls vaccinations resulting in menstrual changes or stops?
So yes, it can, and exactly the same as what I talked about adult women a minute ago. it hasn't been a problem in any of the research on COVID vaccines. And I think what people may not understand at this point, COVID vaccines have been given to over 300 million times just in this country with intensive surveillance. They're now some of the most studied vaccines in human history. I gave it to my teenage daughter, and I'm not particularly worried about this. I think you're going to be fine.
Right. So it's safe to say that that's a myth. So thank you for that clarification.
I think it's safe to say that the risk of something like that is minuscule compared to the very real risks of COVID. It's not even in the same ballpark. We're never going to know things 100%. And some people will say, well, because we don't know this for sure, I'm not going to do it. Well, that's where you've got to have scales. Yes, there are real side effects and people can have problems with COVID vaccines, and the other that we're trying to protect against. And that's the point. That risk-benefit ratio is key. All right. Thank you for letting me digress there. Go ahead, Sunny.
That certainly makes sense. Thank you so much for clarifying. So what vaccines are administered to adolescents aged 12 to 18?
Only Pfizer. Right now, Moderna has submitted. I have not seen that they have gotten approved yet. That should be coming any day. But for right now, between 12 and 17, Pfizer's your vaccine.
Great. So through the presentation, we learned that you are certainly an advocate for mask wearing. So the question is, when would you recommend wearing a mask, and how is it different for vaccinated or unvaccinated individuals?
Oh, I'm so glad you asked that question because, it's confusing, right? LA County says you have to wear masks indoors. The CDC says, well, if you're vaccinated, you don't have to wear masks indoors. But if you're unvaccinated, you do. What are you going to do? I'm going to give you my 2 cents on this. I think right now with Delta, first off, err on the side of caution. If I'm going to be any place that I feel like is a risk, I'm going to wear a mask. That means I'm wearing a mask indoors, even though I'm vaccinated. If I'm in a crowd of people, even if I'm outside, I'm going to wear my mask. And I am absolutely not going to participate in the 3 biggest super spreader activities, which are dining out indoors, going to the gym, and worship services. Those are the 3 big super spreader events. And I'm not going to go to any of those places without really good mask protection. Even if that means working out with a mask on, do it, stay safe. And so I would recommend that for everyone, vaccinated or unvaccinated. You could have a breakthrough infection. You don't want to get COVID. You don't want to be a long hauler. Why not be safe? It's not that big a deal. We've been doing it for a year and a half. Put the mask on. You'd be all right. Just relax with the mask. It's okay. And then when numbers come down again, we can reevaluate. But right now we're in the upswing, and be extra safe right now. Thank you.
Perfect. So on the topic of safety, are vaccinated people really safe when they're around unvaccinated people in closed spaces?
I think not 100%. And so for me, if that vaccine is, 80% effective against Delta, 85, that means I've got a reasonable chance, 1 to 2 chances in 10 of catching it if that person across from me has COVID and we're in a tight space. I'm not going to risk it. I'm going to put my mask on. Yeah.
Great, thank you. So the next question is, what are some concerns that you're hearing from parents regarding school place safety, and what recommendations would you give? School,
yes, good question. We're all worried about our kids, right? Going back, and the new variant is spreading among kids more than the older variants were. So we're seeing big upticks in the teenagers in the kids compared to what we did with the previous versions of COVID. So it has us as parents, we're worried. We're worried about what to do with our kids. Now, the evidence, fortunately, we got a lot of evidence in the last year about outbreaks in schools. And it seems to be true that if schools follow just basic, the outbreaks in schools are extremely rare. And really what that means is having kids wear masks in school. And when they eat, having them be distant. If they can maintain those two things, our kids are very reasonably safe. Now, kids that are going back to sports, and I know a lot of kids doing that right now, where they're not masked, I don't think most of those aren't good, unless you're playing tennis, where you're staying way apart. Most group sports that I know just aren't that safe, and I wouldn't be doing with my kid. And I know that's going to make you going to make you come off really bad with your kid. They'll say bad things about you, but I would err on the side of safety right now.
Great, thank you. Can an infant who has recovered from COVID be considered vaccinated, or just the one who has received an injection? They both convey immunity. So it seems like a play on words, as natural immunity is not listed as a box to check in the forms employers have coming out, and is discounted as viable science. Okay. So what do you say to that, Dr. Rod?
Well, yeah, as you said, I covered this in the talk, and I wish that was true. When the COVID epidemic started, I would have bet that natural immunity would have been as good as vaccination. It just hasn't proved to be. And it probably has to do with the way the vaccine stimulates the immune system. It stimulates the immune system more strongly. And the body just has a more robust immune response than it does to the natural infection. A lot of the problems people have with severe COVID have to do with the way the body's immune system doesn't respond appropriately to it. COVID has some sort of mechanisms that allow it to evade some of the immune system, and then the immune system wires and excessive reaction, the fatalities that we see with COVID. Bottom line, yes, that natural immunity disease was good, but it just isn't good. 50 at best, flip the coin. I'm not play that real protection.
Great, so we're still vaccination. Thank you for clarifying that. So a person who's looking to obtain their COVID vaccination records, and they look on the CA Health website and it says not found. Any advice on how to retrieve their COVID-19 vaccines?
So if you're with Kaiser Permanente, you can get them online on kp.org now. You can print out a vaccine card, your COVID vaccine card. It's under My Medical Record, and then I think it's under vaccines under that, and then you have a button. I did it, and it was great, and I keep it in my car. I went to an event the other day that only vaccinated people could go to, and so it was really helpful to have that and be able to show it. If you didn't get it at KP, any place that gives the vaccine should give you a vaccine card when you get vaccinated. Hang on to that. And you can always go back to that provider, and they'll have record of it if the state doesn't.
Perfect, thank you. I'm a fully vaccinated employee, but I am immunocompromised because of an autoimmune condition. Do you have any updates about vaccine efficacy for the immune compromised? What recommendations do you have for us to stay safe? Yeah.
And this is a tough one. So the difficulty is there are so many different kinds of being immune compromised, so many different ways that you can be immune compromised, so many different levels you could be immunocompromised, that there's just no answer to that question. A discussion with your doctor, if you're taking our drugs, anything, if you're on anything like that, maybe 5% of our population are immunocompromised in one way or another. And all of them, the advice may be a little different, And as I said earlier, if it does make sense to get vaccinated, you may end up having to get a booster as well because of that.
Perfect, thank you. So there's a question in regard to someone who's received the J&J vaccine. They're questioning the efficacy and they're saying, should it be supplemented with Pfizer or Moderna? If so, should they receive 1 or 2 shots?
So right now, nobody's recommending that. We had a lot of questions about 2 weeks ago. Then we got some new data about J&J and Delta. And J&J seems to be doing reasonably well against the Delta. So for now, I would not get a booster with anything. Will you need a booster later? Probably, but I just don't know yet when and which shot is going to be best. So hold that question, and hopefully we'll have answers soon.
So my son's doctor has recommended getting the first dose of either Pfizer or Moderna, and then wait 2 to 3 months to come and get a blood draw for antibody titers. We are concerned about the cases of myocarditis that have been reported after the second dose. I lost my first son at age 18, and I'm super cautious with only 1 child left. Let me know your thoughts on this topic.
Okay. So intuitively, this would be a great thing to be able to do, right? Be able to check my antibody levels and know if that vaccine worked, and then know if I really need another one or not. Trouble is we don't know if it works or not. So much of the protection against COVID appears to be non-antibody mediated, as I showed in some of those slides. Antibody levels don't seem to do a very good job of predicting how immune you are or not. And nobody has done studies looking at a level. So say if any of you have been pregnant, had a baby in the last 15 years, you probably got an antibody test for chickenpox when you were pregnant. And if your antibody level was below a certain level, they would advise you to get a vaccine. The science to correlate that antigen from disease, and it works for chickenpox. We can't do that for none of the professional societies recommend that at all. And then the other thing, all of the antibody tests I've seen, I know there are a few out there, but most of them are against the nucleocapsid antigen, which is something that in the middle of the virus, not the spike protein. So what that means is you would only get that antibody if you had real disease, not if you had the vaccine. Crazy, right? So the reason we like that test is because if somebody comes in and we're worried about them having MISC, the severe inflammation that kids get sometimes after COVID, or adults that are having long hauler syndrome, I want to be able to test and know if they had COVID, and that test will tell me that. What it won't tell me is it won't matter whether they got a vaccine or not, because vaccine wouldn't show up on that antibody test. So just understand the antibody test probably won't tell you anything about vaccines, and none of the science has been done. So I get your concern about your kid and being careful, and I know your doctor's trying to help, but it's just not the most helpful thing is probably to go ahead and get that second shot.
So here's a commonly asked question.
Definitely possible. It's one question we had initially was, would getting vaccinated make you more likely to be an asymptomatic spreader than somebody who just catches it, who's not vaccinated? And the answer to that question has been answered pretty definitively, at least as of May. So not with Delta is what that means, but at least as of May, it was true that catching COVID and not being vaccinated, you were more likely to be an asymptomatic spreader than if you got vaccinated. In fact, people who were vaccinated rarely became asymptomatic spreaders. And that was the key study that had the CDC make the recommendation about well, you don't have to wear a mask now. You remember when that came out and we all like,
Yes.
wow, that's a big thing they're saying. That was why the CDC said that, because we don't have a lot of vaccinated people out there asymptomatically spreading. I think it's likely that Delta may do that a little more than the other variants, and it's certainly possible. So don't count on that won't ever happen. But it's not super common.
Great. I think we have time for another question.
You have a home health provider. If our home health is visiting you, a home health nurse or the home health doctors are coming out, they will arrange for that. And if you have those services with another provider, ask them and they should be able to arrange that. Now with vaccine being in good supply, you should be able to get it. Now, if you're at home and you're not plugged in with a provider, I don't know of a way to get somebody to come out to your house if they're not already doing it. And getting a family member to take you out to a vaccine center is probably going to be your best bet.
Perfect. And would you recommend the J&J for the homebound or handicapped population at this point?
Yeah, that's a wonderful follow-up. I think anybody for whom getting a second shot is really problematic should get the J&J. I recommended it for my sister, who's a single mother, because she has no one there as backup to care for her child if she gets into trouble. She lives in a different city. And the risk of side effects is lower, and she only has to do it once. So for her, it made sense. And I think for a lot of people, if you're homebound, we would certainly be giving you the J&J for that exact reason. I hope you folks got something out of it. We're happy to be here with CSU, and go get your vaccines, reassure your loved ones, and let's get through the rest of this craziness together.
Yes, and thank you so much, Dr. Rott, for sharing this information and answering so many questions today. Like Dr. Rott said, we appreciate this opportunity to partner with the Cal State to offer this session. Today's webinar is being recorded and will be available until August 10th at the link shown on the screen. We wish you a great rest of the day, and thank you so much for being with us. Be well.